why innovation is so difficult, especially in the mental health space. What do you think the reason for that? Is the investment adoption, data scarcity, or is regulation?
For me, it's a question of science. I mean, for years and years, the science was just not there. And what is changing right now is that now we do have the science. So that's why we're today at this turning point, having new solutions, whether it's epigenetics or AI. I mean, 10 years ago, it was just not possible.
That's right.
There's a momentum. That's it.
I completely agree with you. I would add, though, that I think stigma continues to play a really big role. And that gets in the way of people understanding what's coming out scientifically. And I think a lot of really smart people don't go into psychiatry and don't go into research on psychiatric illness because of the stigma.
As an investor, I believe all of the above, but I'm going to add one big thing from my vantage point, and that's investment. It's funding. It's very hard to determine the ROI of mental health, period. When you look at other diseases, I mean, Kelly mentioned it earlier. One of the things I can add to what she said with regard to funding, she's talking specifically about suicide prevention, but smallpox got more funding than mental health the past 50 years from the US government specifically. So nobody's died from smallpox in the past 50 years. Yet it's gotten more funding from the US government than mental health. So I think a lot of it is funding resources, because you can't, again, it just goes right back to measurement. There's no ROI, that it's not as tangible. So we can actually define that and figure that out. I don't think we're going to see much traction.
I have a little different perspective on that. Combined all of this together. It is about a system. Every time you bring an innovation and you want it to survive, your goal is to get constructed in the network and in the system. I'll explain. So you have a lattice. Imagine the molecule. A lot of atoms connected between each other. And if you would like to change the property of this lattice, you need to shake it from every single point, every single molecule. And that's how you can get incremented and change the chemical compound, whatever. Same as with the system. You have a lot of stakeholders, established ones. It's pharma, it's insurance, it's clinics and hospitals, it's FDA, it's a government. And here you are, a little buddy who would like to change the world. Amazing, good luck. The only way how you can get incremented into the system is to get as many support from every single player. So you need to do something for them why they would like to support you. So basically, if you would like your innovation to actually stuck, it's not about the only funding. Funding is actually like the answer from the market, like, doesn't work. It's not only about like the science, because academy is just one pillar of this very complex system. It's about if people actually need you. So if you solve issues for pharma, for insurance, for academy, FDA, EPA, clinic and hospitals, and patients at the same time, then you have a chance to survive. And then you have a chance to get incremented. And the reason why we fail in mental health, that it's quite complicated to build a product which is actually helps all of those players. And we don't have enough matured founders and startuppers like who actually think that way. Because most of them coming from academia or coming from just personal experience, but you really need to like struggle a little bit with the whole market to think, okay, that's what everyone needs. And that's what helps innovation to actually stuck in the system.
I think combine all of your opinion, since it's not really ready or built for innovation yet. So what helps keep you in the course?
My dream for the future is that there is actually no more mental health. There's just health. Because, okay, the brain is complicated, that's true, but it's an organ, and now we see with biomarkers that you can call it mental illness if you want, but it's still biological, just like cancer, just like the flu, or just like any other diseases. And that is going to be so powerful for stigma.
2030 is soon, is really soon, taking account of pharma timeline, for example. So what I expect, having significant amount of data so we can start building new diagnostics, new companion diagnostics. We'd like to see the first drug coming out of the market with companion diagnostic. That's going to change the market and will show everyone the proof that's how it's going to work.
So I would like every pregnant woman to get a blood-based test to predict whether she's at elevated risk or not, and I'd like to eliminate postpartum depression as the most common complication of childbirth.